Imagine waking up one morning and realizing that something you took for granted, something so deeply hidden inside you, has been quietly shaping your life in ways you never noticed. The kidneys, those small yet vital organs, are often overlooked, yet they are the silent custodians of our body's equilibrium. Chronic kidney disease, or CKD, is not merely a condition affecting the kidneys. It is a profound challenge that resonates throughout the body, touching every system, every organ, and every moment of life in ways that are both subtle and alarming. Many people think kidney disease is about fatigue, occasional swelling, or changes in urination. But in reality, it is a ripple that spreads far beyond, affecting the heart, the brain, the bones, and the delicate balance of the blood. As Dr. Mathew R. Weir emphasizes, understanding these far-reaching consequences is not just medical advice. It is a call to consciousness, a reminder that the health of our kidneys is intertwined with the essence of our entire being. When kidney function begins to decline, the heart feels the burden. Blood pressure rises, the arteries harden, and the rhythm of life within us shifts imperceptibly yet dangerously. Suddenly, the body's natural harmony is disrupted. Nutrients that were once balanced become irregular. Toxins accumulate, and energy that fueled daily life starts to fade. The mind, too, cannot escape this silent onslaught. Cognitive functions can diminish, concentration becomes strained, and moods fluctuate unpredictably. What seems like fatigue or forgetfulness is, in fact, the reflection of an internal imbalance that begins in the kidneys but spreads to the very core of our consciousness. Bones weaken, calcium is mismanaged, and fractures that should be avoidable creep into daily life, while the blood, that carrier of vitality, becomes less efficient in delivering oxygen and nutrients where they are most needed. Every heartbeat, every thought, every step becomes part of the story CKD is quietly writing in the body. And yet, this is not a tale of despair. It is, as Dr. Mathew R. Weir would suggest, an invitation to awareness, an opportunity to take control of one's health before the disease dictates the narrative. There is a profound philosophy embedded in this understanding. The body, in its interconnectedness, communicates through symptoms and signals. When we listen, when we honor the whispers of imbalance, we open the door to prevention and healing. The journey of understanding CKD is a mirror to understanding life itself, how small, overlooked actions can ripple into large consequences, and how awareness empowers us to change the course of our destiny. It is in the quiet moments, when we reflect on the fragility and resilience of our own bodies, that the importance of kidney health crystallizes. This is why knowledge is not passive. Each fact about CKD, every connection between kidneys and heart, kidneys and brain, kidneys and bones, is a key to taking proactive steps. It is an awakening to the realization that we are not mere passengers in the vehicle of our health. The kidneys, often invisible in their work, remind us that vigilance, care, and informed choices are acts of both responsibility and self-love. By embracing this awareness, by recognizing that CKD affects more than just one organ, we begin to see the larger pattern of life, interconnected, fragile, yet profoundly resilient. This knowledge transforms fear into empowerment, uncertainty into clarity, and suffering into a path toward conscious action. We realize that CKD is not a sentence, it is a message. And in listening to that message, we honor the wisdom that Dr. Mathew R. Weir imparts. That every organ, every cell, every choice matters. And that understanding the full impact of kidney disease can inspire a commitment to life that is not reactive, but proactive, not passive, but intentional, and not merely surviving, but fully living. As the days pass, the subtle effects of chronic kidney disease begin to weave themselves into the fabric of life, often unnoticed until they become undeniable. It is in the quiet moments, the slower walk up the stairs, the unexpected shortness of breath, the unexplained fatigue, that CKD begins to whisper its warnings. The danger lies not in sudden calamities, but in the slow erosion of the body's harmony, a reminder that the unseen can be the most powerful. Dr. Mathew R. Weir reminds us that the body is a symphony of interconnected systems, and when one instrument falters, the entire composition shifts, sometimes in ways we cannot immediately recognize. The heart, overworked and strained by changes in blood pressure and fluid balance, begins to struggle to keep pace with life's demands. Even simple actions, such as bending to pick up an object or climbing a flight of stairs, become exercises in patience and awareness. The brain, which relies on precise chemical balance and oxygenation, becomes vulnerable to lapses in clarity, memory, and focus. Every misstep, every forgetful moment, is a silent echo of the kidney's compromised function. And yet, the suspense lies not only in the physical changes, but in the uncertainty of what will come next. Will these silent signals escalate into complications that threaten life itself? Will the weakening bones fail to support the body when it is needed most? Will the blood, that carrier of vitality, lose its ability to sustain energy and resilience? These questions linger, hovering in the mind, demanding attention and urging reflection. But within this suspense lies opportunity. Understanding the magnitude of CKD's reach is not meant to frighten. It is meant to awaken. The eyes that recognize these risks gain clarity. The heart that acknowledges these burdens gains strength. The mind that confronts this reality gains resolve. The very organs threatened by kidney disease become teachers, instructing the patient and caregiver alike in the lessons of vigilance, discipline, and self-respect. Dr. Mathew R. Weir teaches that awareness is the first step toward mastery, that the acknowledgement of vulnerability is not weakness but a form of courage. The suspense, the uncertainty, the potential for deterioration, these are the catalysts for action. When one truly comprehends that CKD does not affect the kidneys in isolation, but transforms the landscape of the body as a whole, the choice becomes clear: to act, to intervene, to embrace a proactive approach to health before it is too late. Diet, exercise, medical guidance, and mindfulness are no longer optional. They become essential tools in the fight to preserve life and quality of living. The philosophical lesson is evident. Neglecting small, invisible threats can lead to large, tangible consequences. Life does not always announce its challenges with fanfare. More often it whispers, and those who listen carefully are the ones who survive and thrive. CKD teaches this lesson profoundly, showing that resilience is not built through ignorance or avoidance, but through understanding, adaptation, and consistent effort. As the ripple of kidney dysfunction reaches the heart, the brain, and the skeletal system, one begins to see the profound interconnectedness of all things within the human body. Every decision to monitor blood pressure, maintain hydration, or manage diet is not just a medical instruction. It is a declaration of self-worth, a conscious commitment to life itself. And within this web of understanding, hope persists. Hope arises not from the absence of risk, but from the presence of awareness, not from ignorance, but from action, not from passive resignation, but from deliberate care. The suspense, the tension of unknown outcomes, is transformed into a motivating force. Patients begin to recognize that knowledge empowers them to influence the very course of the disease, that the body's signals, when heeded, can guide them toward a life of sustained vitality. Dr. Mathew R. Weir emphasizes that this transformation, from fear to action, from uncertainty to mastery, is the essence of living with purpose. It is a call to embrace responsibility, to honor the body's messages, and to refuse complacency in the face of chronic illness. CKD, in all its complexity, becomes a mirror reflecting the principles of life itself. Every choice matters, every small action contributes to larger outcomes, and the unseen, when understood, becomes the most powerful force for change and renewal. Now, standing at the threshold of understanding, one begins to see chronic kidney disease not merely as a medical condition, but as a profound teacher that challenges the mind, body, and spirit to awaken to a higher level of awareness. Every ripple of CKD throughout the body, whether it strains the heart, clouds the clarity of the brain, weakens the bones, or alters the balance of the blood, carries with it a lesson: that life is fragile, interconnected, and deserving of conscious care. Dr. Mathew R. Weir, that the essence of health lies not simply in treating symptoms, but in recognizing the invisible threads that connect every organ, every cell, and every moment of living. To understand CKD in its full dimension, is to realize that our actions, choices, and attentiveness have the power to shape outcomes, to transform vulnerability into strength, and to turn awareness into action. Imagine the heart, once overburdened, gradually regaining rhythm through careful management, patience, and lifestyle adjustments. Picture the mind sharpening as oxygenation improves and chemical balance is restored. Envision bones strengthening as nutrients are monitored and guided. These images are not mere hopes. They are possible realities, achievable when knowledge is paired with determination and sustained effort. There is an undeniable beauty in this realization. The body, though fragile, responds to intention, and even the silent whisper of a failing kidney can be heard, interpreted, and acted upon. The philosophical depth here is remarkable. CKD is not just a disease. It is a mirror reflecting the broader truths of life. Small, consistent choices lead to significant outcomes. Neglect invites deterioration, but engagement invites resilience. The suspense that once hung over the unknown consequences of kidney dysfunction is now transformed into clarity, motivation, and empowerment. It is in the recognition of this power that one begins to transcend fear. Patients and caregivers alike are encouraged to step into a proactive role, to embrace medical guidance, mindful nutrition, and balanced routines as instruments of control and care. Dr. Mathew R. Weir that emphasizes the importance of education, reflection, and self-awareness in navigating these challenges. Every day presents an opportunity to listen to the body, to honor its messages, and to act in alignment with the understanding that the kidneys, though often unseen, are central to the symphony of life. Empowerment comes from this very recognition, that the unseen is not unmanageable, that the silent is not indifferent, and that knowledge is the most potent tool available to combat the multifaceted effects of CKD. Beyond the medical interventions, beyond the clinical routines, there lies the spiritual and mental transformation, the realization that we are co-creators of our health, that awareness fuels action, and that intention has the power to reshape outcomes. This awareness instills a profound sense of responsibility, not as a burden, but as liberation, the freedom to influence one's well-being and to honor the interconnectedness of body, mind, and spirit. The journey of living with CKD becomes not a narrative of despair, but a story of courage, discipline, and hope. Every symptom becomes a signal, every challenge an invitation, and every day a canvas upon which proactive choices paint the colors of vitality and resilience. As one reflects on this journey, the teachings of Dr. Mathew R. Weir resonate deeply. Health is holistic, awareness is empowering, and understanding the full impact of kidney disease is the first step toward reclaiming control over one's life. In embracing this philosophy, patients no longer feel like passive observers of their condition, but active participants in their healing. The suspense of uncertainty transforms into deliberate, mindful action. The whisper of imbalance becomes a call to attention, and the ripple of CKD across the body becomes a catalyst for intentional, life-affirming choices. Through consistent effort, patience, and self-compassion, the body can be supported, the mind can be sharpened, and life can be enriched. And so, this journey, though initiated by a silent disease, evolves into a powerful narrative of awareness, resilience, and empowerment, a testament to the human capacity to rise above adversity when knowledge, mindfulness, and action converge. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.